the treatment of localized prostate cancer has changed significantly since the advent of PSA and the fact that we've been diagnosing a significantly higher proportion of local, potentially curable disease. And the role of surgery has improved significantly from the open prostatectomy to the perineal prostatectomy to now the robotically assisted laparoscopic prostatectomy. And that's just surgery. And the advances in radiation have actually increased significantly from plain standard external beam to 3D conformal therapy to, we had a period of neutron beam, now we have proton beam. We're trying to use every single part of the atom to treat prostate cancer. Now with advances in brachytherapy, whether it be low dose rate or high dose rate, and I know I'm throwing them all out kind of quickly. What I'm saying is that there's so many choices available for local curative therapy. And it's really important to get enough opinions and enough education in this process to go to somebody that is really well-versed in how to actually address it and choose what is best for you, not what's best for them, but what's best for you. And so my next question is going to be to Dr. Hafron, and it's about the role of staging for prostate cancer. In urology, we used to always perform bone scans and CAT scans for early diagnosed prostate cancer. And then we found out that that was kind of heretical. And we stopped doing it if you had a lower Gleason score and a lower PSA because we knew that they'd be normal. But what do you think is the role of MRI for glandular staging as well as for PET scans for systemic staging? And what are the options here in the United States?
Yeah, that's a great question. And, you know, we just got off talking about genetics. This is probably another one of the hottest areas of prostate cancer. And it's whether it's at the localized or the advanced level, we're seeing a major revolution in imaging. You know, I think MRI imaging of the prostate is critical. It's beneficial. MRI imaging allows us to see inside the prostate that we never really had. So we can see with pretty good sensitivity and specificity where that tumor is, whether it's inside the prostate, it's near the capsule, or it's, you know, kind of leaking out a little bit. So that helps us deciding whether we want to consider surgery, whether we want to consider radiation. So I think MRI imaging has quickly become a standard in evaluation of localized prostate cancer, whether we're going to treat them or whether we're going to follow the patient. You know, it really defines and helps stage the extent of the disease. So MRI imaging is critical and very helpful in everyday practice. And I think what you alluded to or talked about briefly is PET scan imaging. PET imaging is the future of advanced prostate cancer imaging. Again, we're just at the start of it. We have now we have two approved, actually. We just got an approval this week. We have the oxymel or fluciclovine PET scan, which is a great study for advanced or in biochemical recurrence. It's a PET-based imaging study that is available at most hospitals. And I think this week, and Elizabeth will probably know this better than I, PSMA imaging, which has been widely used in Europe, is been approved in the United States. It's going to take some logistical and some work to get this out clinically, but this technology is awesome. We can see cancers or localized cancer that we never saw before. So again, another major improvement or revolution, what we're seeing right now unfolding before our eyes.